the way in which we bring children into the world, regardless of, like you said, all these other factors, is incredible. It is holy. It is divine. It is the most magical thing. So yeah, we're never trying to rob from that experience. And parents are making the decisions that feel best for them with the information that they have. And so I want us to arrive at a place where every person feels they were given the information they needed to make the most informed decision. Because so many of my girlfriends who have given birth later say, I just didn't even know. They were telling me something about, oh, we can't hear the baby's heart, or the baby's in distress, things like this that are actually very typical in birth. But then they felt that they needed to make a call or a decision, and then they later find out, oh, that was a normal thing. And so for me, I give this answer with that in mind. I simply want people to know the information and then be able to decide what will be best for them, so that when they go through that experience, they come out on the other side feeling like, yes, I made the decisions that were best for me. And in the book, I explain there's so many different pieces of information that I include in there. The motherhood reproductive chapter is very long. It's a whole part 3 of the book. But to summarize it, I think we can talk about 3 men. One is the father of modern medicine, Flexner, who you mentioned. Then there's the father of gynecology, J. Marion Sims. And then there's the father of obstetrics. And I can't remember his name currently right now. But all 3 of these men, particularly around women's bodies, they believed that women's bodies needed to be controlled, that women's bodies were deficient, and that women's bodies needed really the input of men, because at the time it was mostly men who were practicing medicine. And when the Flexner report came out, Flexner was trying to figure out how to make a more what's the word? A medical system that was more uniform. There we go. That's the word I was looking for. Thank you so much. And so he makes certain decisions. So he says that he's going to shut down certain medical schools. A lot of the ones that he shuts down were educating Black people and were educating women. So as a result of him wanting this uniformity, that on one hand was a good thing, we needed more uniformity, that was true. But the way in which he decides what gets to be the uniformity, he sets it up in a way where white male physicians are the ones who are in charge, and that the white male body is the one that we're all going to see as the example of health. So by design, anybody else then defaults into being seen as diseased, or being seen as having a problem that needs fixing. We then see with the father of gynecology, the way in which he becomes the quote father, and it's pretty, I guess, ironic that you have a father of gynecology and a father of obstetrics. It doesn't really make sense. Why don't we have mothers of that? But the father of gynecology gets this title because he experiments on women and girls who were enslaved without giving them anesthesia. So he's cutting directly into their bodies to perfect his procedures. He's having people come and watch while he's doing this so that he can show the female anatomy, right? And again, treats them as animals. But his way of thinking about bodies then becomes the way we actually still think about these procedures. And then the father of obstetrics, he believed that midwifery in particular was dirty, unsophisticated, and that birthing women needed to be in hospitals. Even though midwives had been the experts in this right from the beginning.
Millennia, yes.
And also midwives were very willing to share their wisdom with doctors who came and said, we want to take over. And so at the beginning, when we transitioned in the United States to women giving birth in hospitals, you see a rapid decline in birth outcomes. And you see women dying, you see babies dying because of all of this experimentation, versus seeing this body, this birthing body, as knowing what it needed to do, as women really connecting with their intuition, hearing from elder women who are guiding them through the process, it becoming a community thing where other women are surrounding them. And medicine isn't really all that necessary. And so it then transitions in the US. We then become seen as, again, from the beginning, default disease, right? So women come into hospitals and they're put in wheelchairs. Why? Doesn't really make sense. Women then are put on.
So true. Why?
Who knows? Women are then plugged up to IVs. Not really necessary. Keeps you from moving. Doesn't really make sense. If a woman throws up during her labor, which is very normal. I threw up in my first labor. If I didn't have my doula there with me, though, to tell me that's normal, the nurse was very ready to give me some kind of medicine to keep me from feeling nauseous. I would have then felt more drowsy during my labor. So it's all these things that were seen as normal, natural parts of labor are then over-medicalized. They are treated as very extreme. And the thing that we have in common between all of these three men is that they thought women's bodies needed to be controlled. They also saw labor as damaging to both women and children, and that they could be the ones who could solve the problem and make it less damaging. So one of the methods I talk about in the book that became really popular was drugging women who were birthing so that they wouldn't remember the experience. And then the evidence came out that these women were thrashing and hitting their heads against walls. The babies were born drugged, but it was advertised to everybody as we have perfected labor, us men, and made it easier. So women just come, you're just going to sleep and the baby will be here when you arrive. And only the nurses and doctors knew what was really happening behind these closed doors. And so it all plays a role in how we still see birthing bodies to this day, and why we have such a high maternal death rate in the United States. It's something that affects all people, all women in the United States, but it disproportionately affects Black women. Mothers are dying at extremely high rates in the United States. And the data shows us that we could solve this and save women's lives, save babies' lives, if today we embraced midwifery just as much as every other industrialized nation does. But in the US, we're still told this propaganda that midwives don't know what they're doing, that they're not medical experts, and that all women need medical intervention. When we do need medical intervention, we are so grateful for it. Absolutely. There are certain procedures that have saved lives. And again, I've heard of many friends who, yes, they needed medicine, they needed intervention. In those cases, wonderful. But when it is not necessary, it has created so much more pain. It has created doubt in women because in order to control this process, women then have to believe themselves that they don't know what they're feeling, that they don't know what decision to make for themselves. They need some other authority to tell them. So you have women who have never given birth saying, I'm afraid to give birth. I don't want to experience that pain. So it's fearful from the moment we're even thinking about it. And so I was really grateful. The reason I made these decisions to have a doula, to have a midwife, is because of my first book. I was researching the treatment of motherhood in the US, and specifically the treatment of Black motherhood. And I realized the data is clear. If you can have an unmedicated labor with a midwife at home, your recovery is much faster. Your baby tends to have much more consciousness faster. You yourself have this empowered experience where you then, as a mother, even after you've gone through the labor, you're feeling like, I know what calls to make. I'm confident in myself. My intuition is telling me what to do here. And when you talked about laying with your daughter, we're told in American medical systems not to cuddle with our kids. We're told don't co-sleep with them. You might hurt them. Don't pick them up when they're crying. You're going to coddle them too much. Put them on a feeding schedule. So you have mothers who, I have seen so many babies, they're crying, and moms are looking at their watches or looking at their little apps on their phones. I don't mean parents. Let me not just make this about moms. Parents saying, oh, well, we have still 10 more minutes on here. the child is crying, just pick up the child. And so for me, I parent from a lot more intuition and what just felt right to me. It always felt right to me for my baby to lay on my chest. I felt I could hear them breathing, so I could sleep. Versus if they were in a bassinet, I kept getting up, trying to check. And so I'm not saying everybody makes those decisions. There's some people who are like, a baby on my chest, I can't sleep that way. So choose what works for you, but listen to your intuition and be aware that there are years of history behind this that are intent on making you feel like you don't know what you're doing and you need somebody else to tell you. But all of that is strategic and all of that was by design. And I know this is a very long answer, but the very last thing I'll say about this is even doctors who are women, doctors who are people of color, they have been trained in the system. So they also believe that your body needs medicine and your body needs control. And you'll see, and you can look up these stories. There are OBs themselves who are women who then, once they've gone through the process, realize this is not how this should have gone. This system isn't working. And so I advocate for more concurrent care, more midwifery, more doulas. And if you still want to see a doctor because you're somebody who thinks, what if something goes wrong? I did that with my second too. My second and my third, I had a doctor. And I would also go and see them mainly because I found it interesting as a researcher to do both. But yes, so that's a very, very long answer. But like you said, it's so important. And it's related to everything that comes after that birth experience.